Nabeela from Dhaka Community Medical College. In today's video, I will be teaching you about the branches for the external and internal iliac arteries. As we have seen in our previous videos about the branches of the abdominal aorta, and we know that abdominal aorta is having a terminal branch, and that is the right and left common iliac arteries. Okay, so these right and left common iliac arteries then further bifurcate or divide into the external and internal iliac arteries. Now, this thing that I will be teaching you today is not very important, obviously, from like written exam point of view or something. But when you will give your viva or further your the competitive exams, then it will be very useful, inshallah. But out of this, there are some things again which are very essential in your vivas. So I will be telling you that also, inshallah. So let's start with, without wasting much time, the external iliac artery. It is having three branches basically: the inferior epigastric artery, deep circumflex iliac artery, and the femoral artery. Okay, so these are the three arteries. Okay, so you may be asked in the exam, okay, what are the branches of the external iliac artery? So you have to say these three. Okay, but one thing that I would like to tell you over here is this: the femoral artery. It is very important over here, as this femoral artery it is the terminal branch of the external iliac artery. Okay, so in the exam you may be asked, okay, the femoral artery is a branch of, then you have to tell the external iliac artery. Then they will ask, okay, external iliac artery is a branch of, then you have to say common iliac artery. Then after common iliac artery, then you have to say it's a like terminal branch of the abdominal aorta. Then abdominal aorta is a branch of descending thoracic aorta, and so on, right? So this is above we are going when, okay, suppose you will be asked, okay, in the popliteal fossa, which artery supplies the popliteal fossa? Then you will say popliteal artery. Then you will be asked, okay, which popliteal artery is which artery is branch? Then you have to tell the femoral artery, and then further again above. Okay, so femoral artery, it branches in the popliteal fossa into femoral artery. This this popliteal artery, it again branches into anterior posterior tibial arteries. Okay, so these anterior posterior tibial arteries, they basically supply the leg, and popliteal artery supply the popliteal fossa. Femoral artery supply the thighs, obviously, and obviously major part of the lower limb artery supplies the femoral artery. Once again, one again important question over here will be the anterior the arterial dorsalis pedis. Okay, this artery, it is used to see the pulse, okay, in the lower limb when we are seeing. Apart from other arteries like radial artery, brachial artery, femoral artery, there is one more artery, that is the arteria dorsalis pedis. Now this artery is a branch of the anterior tibial artery. Okay, and this anterior tibial artery, again we know that it is a branch of popliteal artery, and then femoral artery, and so on. So this is the viva question that you will get very often. Okay, so next is for the internal iliac artery. The internal iliac artery, it basically is having two divisions, anterior and posterior division. First of all, I will tell you the artery names, and then I will tell you the mnemonic for this. Okay, so the posterior division is having just three arteries: the iliolumbar artery, okay, then lateral sacral artery, and superior gluteal artery. The median sacral artery, as we all know, it is a branch of the abdominal aorta. Okay, it is a dorsal branch of abdominal aorta. So the lateral sacral artery is a branch of posterior division of internal iliac artery, and the superior gluteal artery, obviously gluteal means gluteal region, it will be supplying the gluteal region. So there are three arteries: iliolumbar, lateral sacral, and superior gluteal. Now internal iliac artery, anterior division arteries. So I'm just telling you the name, then I will tell you the important arteries out of this. This is the obturator artery, inferior gluteal artery. Superior gluteal artery is a branch of posterior division. Inferior gluteal artery, branch of internal iliac artery, sorry, anterior division. Then umbilical artery, uterine artery, vaginal artery, these are obviously just in female. Then deferential artery, it is the artery supplying the vas deferens, is obviously present in male. Then inferior vesical artery, middle rectal artery, and inferior pudendal artery, or just the pudendal artery. So these are the main arteries of the internal iliac artery, I mean branches. Now here is the mnemonic. Obviously, when you don't have to essentially retain this, okay, this is the branch of anterior division or posterior division. Even if you are asked in the exam, okay, obturator artery is a branch of, so you don't have to necessarily say, okay, it is the branch of the anterior division. You can just say it is the branch of the internal iliac artery. So the mnemonic is: I love going places using my very own unnamed vehicle. Okay, a person is there who love going to the places by using his own vehicle, but the vehicle's name is not named. Okay, so I stands for iliolumbar, iliolumbar artery, L is the lateral sacral artery, and G is the gluteal artery. Gluteal includes both superior gluteal artery and inferior gluteal artery. Then we are having P. P for we are having the pudendal artery. U is having the umbilical artery. M stands for the middle rectal artery. V stands for the vaginal artery, or you can vaginal artery. Then O is for obturator artery. U is for the again uterine artery, and V is for the inferior vesical artery. Okay, so this is it. But the most important out of this is obturator artery. It also supplies the medial compartment of your thigh. Okay, so if you will say okay it supplies the thigh, then you will be asked okay obturator artery is a branch of which artery, then internal iliac artery, then again common iliac artery, and so on. And then again uterine artery, vaginal artery, it is a branch of, you will be asked in the exam. Okay, so these are the three main arteries, and obviously umbilical arteries sometimes may be asked. So these are the four arteries that you may be asked. These arteries are branch of which artery. Okay, that's it. Hope you like this video. Please do like, comment, share, and subscribe, and please do write in the comment section which videos you want the next. Thank you.